So I'm Anna-Maria Forsea. I'm a dermatologist. I'm assistant professor of dermatology at Karol Davila University of Medicine and Pharmacy in Bucharest. I'm a board member of the European Association of Dermato-Oncology and member of the International Advisory Council of the Skin Cancer Foundation in the United States. I think early detection is the crucial issue in melanoma and also in skin cancer, at least for melanoma, as far as we don't have an effective treatment in advanced stages. Early detection, it's actually the only working weapon that we have against this tumor. And it's very important to do this, but for this you need first the people to be aware and to seek medical attention, and then you have to have the medical facilities in terms of people and of equipment to meet them and to meet this request. And this is sometimes a difficult match to do, especially in parts of Europe like Romania, like eastern part of Europe. This has been one of the focus of my research lately, the disparities in early detection and access to medical health care between regions in Europe. It's very interesting because somehow we think about Europe and we talk about Europe like a one unit. And then when you look a little bit closer, then you realize how extremely heterogeneous this continent is. And actually it's not only about the good part of multicultural diversity, it's actually more like disparities, severe disparities in access to health care. And in this part of Europe, the southeastern part of Europe, actually people are dying from thick melanoma, advanced melanoma, because they just don't get diagnosed in good time. And there is a big difference between what we usually read about melanoma situation in Europe, which this information comes mostly from the western part of Europe, and you see thin melanoma diagnosed, early detection functions, melanoma clinics are in place, and this is very nice, but this information comes mostly from the western part of Europe. In eastern part of Europe there's a totally different kind of picture. It always comes to financial shortages, but it's more like the use of this financement and of money. There are many things compounding the situation. The people are not aware of skin cancer, and there has been a lack of information and of campaigns and of public education for the people in this region of Europe. Second, there is a problem of specialized healthcare. The professionals are not there. They are concentrated mostly in the urban areas, and you've got big, large rural areas with no physician, with no specialist care. And then there is the migration of health work, of health professionals, both between rural and urban areas, but now between east and west. And to this, the lack of facilities, like material facilities, diagnostic tools, dermatoscopy, it's like granted in western part of Europe, it's not granted in Eastern Europe. Pathology to diagnose a melanoma, it's not granted in eastern part of Europe. And to this, it adds that sometimes the administration, the authorities, overlook the problem of skin cancer for many reasons, but mostly the authorities do not understand maybe the problem and do not offer too much support to this issue. Melanoma in teenagers or children, it's really very rare. But what you need to communicate to them and transmit to them is primary prevention, so stay out of the sun, stay out of the tanning beds. This is a huge problem. Which in eastern part of Europe it's only emerging. So the problematic in the western part of Europe, where intense use of tanning beds have led to increase in skin cancer, this phenomenon we're only starting to witness in Eastern Europe, because now we are accessing to the financial situation is getting better, the fashion goes a little bit from west to east, and now we will face the problem that the western part of the world has already been facing. We would say to the teenagers and older children to watch their skin, and maybe to invite their parents to watch their skin. Sometimes, a message from a child goes better to the adults than from a doctor. So why not? Check your skin. The pity is that melanoma, unless any other cancer, you can see it from the very beginning. And it's crazy that people still die from melanoma when it's visible for the naked eye from the beginning. This is a paradox. It's there. You don't need mammograms, you don't need, blood tests, you don't need complicated and costly tests. You just need to watch. And the problem is that the people don't watch.